Hi, my name is Alex, and I'm here to talk to you about our company, Catalytics. Today, I would like to introduce to you Jane, a 65-year-old Hamilton resident. She is a complex patient suffering from multiple chronic conditions, including COPD. Because of her conditions, Jane frequently visits the hospital, sometimes 25 visits in a single week. In her latest visit, she was advised to take some medication and then discharged back home. Unfortunately, Jane has not yet been identified as a high-utilizing patient, which would help notify providers to put together a personalized care plan for her and would in turn improve her health outcomes and likely reduce her readmission rates. Unfortunately, Jane is not the only one who repeats this process of being readmitted to hospitals on a regular basis. In Canada, 5% of the population accounts for approximately 50% of all healthcare costs. In Ontario alone, this accounts for $4.4 billion in healthcare expenditure. Today, hospitals understand the importance of helping patients like Jane, but are limited in their ability. Currently, there is no effective solution to identify high utilizing patients early on. Right now, hospitals are limited in their ability to identify at risk patients. They are dependent on claims data, which is received 60 days after the patient is discharged and only provides insight into their medical information. This allows for patients like Jane to slip through the cracks, as she will not be identified as a high utilizing patient early on. Jane's health will continue to deteriorate until she is identified as someone who needs extra care and a personalized plan is put in place. Hospitals have expressed interest in being able to identify who high utilizing patients are early on in order to provide better care, reduce readmission rates, improve outcomes, and reduce costs. Our research has shown that one of the most important predictors of identifying patients like Jane is to look at her social determinants of health. This includes her access to transportation, her social network, family support, and income, among others. Patients who are socially economically disadvantaged are likely to be more at risk of becoming high utilizing patients and not receiving the proper care that they need. In this situation, Jane is unable to work, has no disability, and no caregiver. These factors have played a significant role in Jane's deteriorating health and ability to receive the proper care that she needs. If she had better access to care and resources in the community, she will be able to improve her overall health. We aim to support hospitals in identifying high utilizing complex patients to ensure that they get the help that they require and are treated for the root cause of their health issues rather than their symptoms. When a patient is admitted, our end-to-end system analyzes their electronic health record and uses predictive analytics to develop a warning score for identifying high utilizing patients based on known influencers such as social determinants of health. That patient is then referred to services within the hospital, such as occupational therapy and ambulatory care, as well as third-party services, such as government income or medication delivery, that are aimed at reducing some of their social determinants of health. Our software is unique because it can eliminate the 60-day delay to provide real-time identification of which patients are at risk of returning to a hospital. Moreover, this care model has been shown to decrease costs and improve patient outcomes. By intervening in a timely manner, hospital readmission rates should decrease and patients can be relieved from preventable chronic conditions. This means that patients like Jane will live a happier, more enjoyable life as her health will improve. Putting together a better care plan for these individuals early on will also lessen the strain on caregivers, as patients and older adults will be receiving personalized and better care.